Now, ladies and gentlemen, this afternoon we have a team of eminent, I call them personnel, who will be upstage to take us through innovative healthcare and insurance for all. So let us give a round of applause to the following ladies and gentlemen. First, Madam Winnie Wangari, as she comes. Winnie comes from Vilgrove. So as they come, they will introduce themselves and give us a short presentation of what they are offering with the questions, right? Welcome, Winnie. Then we have Judith Owur, the CEO founder of Ambulex. Dr. Billy Njuguna, the CEO of Edgewell Clinics. So thank you very much. Now you will introduce yourself, tell us what you do, and then from there we'll pick up with the questions. So we have 35 minutes beginning now. Daktari, gentlemen first.
Good afternoon. Yeah, my name is Billy Njuguna. I'm CEO of Edgewell Clinics. And at Edgewell Clinics, we are the first integrative medicine clinic in Kenya, where we do integrative protocol. We offer integrative protocols. Integrative medicine is the combination of complementary medicine and conventional medicine. And majority of people really look at integrative medicine as like a new thing.
It's okay. It was an introduction of yourself, right? We have 35 minutes. Thank you, Dr. Ribele. We'll come to what you do. Everybody has been given a pen and a paper. Kindly make use of it, because I will ask you a question if you don't ask them. Right? Okay. You can use mine.
Good afternoon once more. My name is Judith Okech, CEO and founder of Ambulex Solutions Limited. We offer emergency medical services.
My name is Winnie Wangari. I'm the MedTech lead at Vilgrove Africa, and Vilgrove Africa is an impact and social incubator that supports healthcare innovator startups in Africa.
Thank you very much. Now, we'll move very fast again in that order. Now, you tell us what you do and the impact you have in innovative healthcare.
Thank you. Edgewell Clinic, what we offer a combination of natural healing molecules with conventional. So what we do at Edgewell Clinic, as part of innovation, we are the first clinic to introduce integrative and precision medicine, whereby as a patient, instead of giving you prescription, we can be able to compound a molecule specifically designed for your gene profile. So that's the innovative part of Edgewell Clinic.
You've lost that a little bit by saying molecular design something. What was that again? Just make it user-friendly. How many doctors in the room? You see? So just come down to earth.
Edgewell Clinic, what we do, instead of giving you prescription, once you come into our clinic, we go through the normal procedures, but at the fine where you need to be given a medicine or a prescription to go and buy in the pharmacy, we don't give you that. We give, we compound drugs based on your gene profile. We don't just give you prescriptions. We compound molecule based on your need. There's that part where, the easiest way to say is that they are not all drugs you find in the pharmacy that are personalized to you as a patient. So we personalize medicine based on gene profile of a patient.
Okay. So assuming we have diabetes and hypertension, So you don't just give me prescription to go buy. What do you do?
We have a compounding pharmacy.
Uh-huh.
A compounding pharmacy is the first one in Kenya, actually, where we can be able to order the particular molecule that you need, and then you can be able to compound it within hours and you give it to a patient.
So by compounding means you have to see what I'm made of.
Yes.
Then if that drug will be effective in my life, how much does it cost?
Wow, it all depends what you're suffering from. But that you can consult me later.
Innovative healthcare is what we are talking about, and insurance for all. Yes. Wait a minute. You're ambulatory. Let's hear from Vilgro, and then we'll come to ambulatory.
Thank you. So for Vilgro, we nurture startups in healthcare, more precisely in companies that are focusing in the bottom of the pyramid communities, and more precisely that provide social impact to those communities. And we try our best to nurture them in terms of thinking in the business, improving their technology that encompasses health sciences. What I mean by health sciences is either you're coming up with an innovation or a startup that focuses not in medicine per se, you're not focused in medicine, but more on hardware technology, whether it's biotech or medtech, or even a digital solutions that come in hand with you providing impact to the community.
Now, assuming that we have a CBO here, or they're outside there, how do you come in?
So we come in by providing hands-on technical support. There could be that they are seeking or they have a gap maybe within the team that they lack some skills, or they don't know on how to operate as a business, or even they don't have the enough capital to move forward with what they want to go ahead to do, right? So we not only just provide, technical support to tell them this is how your business should set up, this is your business model, maybe could you rethink it differently so that more people could be onboarded. Other ways will be through some investments that we provide to them that will be beneficial internally for their growth.
Awesome. Now, a question that I'll ask you is, if you go to their countries like China, Japan, Indonesia, their children and students, at their free time, they make these watches that have heartbeat or things like that, right? And then they cost cheaply in Kenya. Can you find something like that to be done in Kenyan Polytechnic?
We actually are doing that
Okay.
with our partners and startups that have been interested to be part of our initiative. And actually, we are running our third year annual conference called Transforming Africa MedTech Conference, advocating for local homegrown medtech and biotech solutions, those health technology hardware solutions to be made here in Africa for Africans.
That is a place where you all clap. Or you are taking notes. Thank you. We are coming back to you, Ambulex. You told us to download an app. Just wait. Akose, what is our social media handle? Because social enterprise goes with the social media. Anyone who has seen Akose online? We are not trending today or tomorrow but one? You've seen? No, you come and tell us so that we can take photos and then we go to ambulatory to download theirs.
All right, so you can find us online on Instagram at Akose. So Akose is A C-O-S-E, that is Akose. On Facebook, it is on Facebook, the name is Annual Africa Conference on Social Entrepreneurship. On X, it is Akose_org. On LinkedIn, Annual Africa Conference on Social Entrepreneurship. We'll be having that rolling on the screens as we proceed. Thank you.
I didn't see anybody holding a phone up. Okay, we'll be back at that. Ambulex, tell us, we've seen what you're offering, and you've told us to download an app. Now, how many ambulances do you have in Nairobi?
We have 80 ambulances in Nairobi.
80.
80, and across the country, 227.
Do you have a matrix to which you're using to place an ambulance in a place?
Yes, so for example, in Nairobi, we've placed ambulances across major roads to enable 15 minutes of response time. And we do the same with, so you find that, for example, in other areas that are not necessarily towns, you find we have maybe one ambulance, because what we are doing, ours is an Uber-like model. We do not own these ambulances. We are providing opportunities for people who own ambulances, including hospitals and even some churches and individuals. So what we're doing is providing that platform for them. We are linking them to patients. And so we are working with more than 227 ambulances across the country. But beyond that, we are also working with individual emergency medical technicians and paramedics who respond to emergencies using motorbikes, and they're equipped with trauma kits. This is especially for hard to reach areas like in some rural settings or in some slum areas.
Okay. How many call centers then do you have for these 220 plus ambulances?
We have one call center. Maybe also just to reiterate that we are decentralizing response because it's Uber-like. Basically on the app, once you place a call, you just tap, the closest ambulance to you will respond. And so what our call center basically does is just follow up. We are monitoring the response and not necessarily linking you. So we are monitoring because this is a medical situation. We want to ensure that whoever is responding has actually gotten to you and has assessed your situation and knows what is the next solution to your situation.
Okay, as Dr. Billy thinks about the impact of his product, one more question for you. Are these 200 private-owned ambulances, or we have public as well?
We have public as well. We are actually working with even major ambulance or ambulatory service providers, including Red Cross and St. John's Ambulance. So we are basically providing the platform for them to access patients. So we also have the then Nairobi Metropolitan in our services as well.
Awesome. We're talking about innovation. Now, one question that I will ask you, but after Billy, is in 2013, I think I bought 70 ambulances for Machakos County, and we had 3 call centers from the region. And one of the hardest questions I was asked is, why do you think the county need 80 ambulances for what, right? And that was a very hard question for me to respond because it was a political statement, but we delivered, right? Yes. Now, Dr. Billy,
Yes.
impact that you've had within your program and your network, and where do you currently operate from?
We have one clinic in Hurlingham at AP Arcade. We're on first floor, suite 9. And what I will say, and I will ask the audience as well, is that when you hear about integrative medicine, majority of people don't really understand what is integrative because it looks like it is a foreign thing. But integrative medicine is natural medicine. How many here have used lemon, tunaita dawa?
We normally buy it at 250 at Java or someplace. That's medicine, right?
Exactly. So at our clinic, when I mentioned about compounding, we use natural compound, natural molecules, like hiyo dawa unakunywa. So there are those molecules that we extract, from different plants, and then we extract the what you call the active molecule into it, and then we make a drug out of that. So, and then what I can say about the impact is that what we are looking for is that 70% of Kenyans, and the studies there you can even check, use natural medicine or they use traditional medicine. But you find the challenge is that we are not able to have a way or to standardize the delivery of these protocols or of these services. Age-Well Clinics is coming to bridging that gap where you can be able to come as a patient and get exactly what you want in the best form, in the best formula, as in IV form. If you want a natural molecule in IV form, you want whatever it is, but you're able to get it as the best standard you can get.
Thank you very much, Dr. Billy. Now, the biggest problem we have in Kenya with what Dr. Billy is saying, this field has been left for commercial business persons who are not necessarily in healthcare. We've given it a name. This name is called multi-level marketing. So they sell herbal drugs, but in a multi-level marketing formation, and they're not doctors, but we all buy from them. So is it part of regulation, policy, or what is the problem with Kenya?
What it majorly is the policy, because we have presented this bill in Parliament, but since it's not pharmaceutical driven, you lack sponsors to sponsor the bill or the goodwill to to get it done. But at the moment we have a bill in Parliament, a petition in Parliament which was presented like 2 weeks ago. And we are hoping that when that comes through, it will be able to bring a policy that will be able to regulate this industry.
Thank you. They have a challenge because currently they are being under the Ministry of Culture. They are categorized together with herbalists and the witch doctors. Now there's the problem, right? Yes. Now we are talking about technology. Yes. How can we, in such a scenario, use technology to help our young people, even our old people, to access such a service through your organization?
So I'll say a lot. Just let me share back about what of the gaps we've seen,
Okay.
even though someone has done the work, right? Within the healthcare sector, you don't just do the knowledge understanding from the basic gap that you're trying to address directly from what you see, right? It's very definite that every researcher or any innovator that is trying to onboard a technology of whatever sort, you need to understand, you need to do a deep understanding of your need, the need of the users, and diversify the need as much as possible, differentiating with the different users. It could be that you know one sector of the user, but there could be other users that they may benefit from the same technology. So you need to understand the problem from the different dynamics, demystifying how that will affect them depending on the technology that you're bringing on board. So one of the things we always look at is that need. Do you understand the problem and the solution you're coming up with? The technology that you're trying to onboard, how feasible is it to be uptaken to these users? To yourself as a team, do you have a team that can do that? And also to the environment, considering the environment itself, how will they be willing to accept such technology? And that will be considerate the knowledge and skills that has been brought up to the society. And that could be, are you bringing a technology that will make us, pull them back or lift the community, or just gonna be more of bringing more hurdles to the community? It could be good. Yeah, you think it's good. It could actually solve what you're trying to do. But how does it affect the environment? How does it affect the governance? Going back to the understanding of policy, standards, and regulations around that particular solution you're coming up with. Majority of them don't do that background check. Like now with the genomics and the medtech and biotech solutions, you really need to go back to understand, okay, I have understand the need. I know that the technology I'm bringing on board will very much fit into the environment. There's standards and there's regulations around that, whether it's international, regional, or the local regulations, that you need to as well to understand your limitations where they are. And you just don't create a solution, just you think it is gonna make it, right? So there are so many things to look at, and that's what many people don't go through.
In the next 10 minutes, we need 5 questions from you, and then we do lunch. So the faster you ask the question, the faster we go for lunch. Okay. Where's the mic? 5 questions. Your questions determine the lunch. Yes, at the back. I'm only seeing smiles. Yes, we have one hand here. 4 more remaining.
Okay, thank you. My question is for Dr. Billy. For the integrative medicines and whatever you're using, do they actually go through the rigorous process of actually getting them to be medicines that actually function? Yeah, or are they just, where we've been placed? So how do you get me to come in and take your medicine? How do I know that it is at par? Thank you.
Okay, let's get the questions and then we'll respond, then we do lunch. Wamesema hiyo ni mitishamba, eh?
Thank you for the presentation. Tamale Joyce is my name. Mine goes to Bill Grow. I'm interested and I appreciate your work. So I would like you to share with us the healthcare incubated startups that you've supported. How many have you seen scale from zero to the next level? Can you give us some examples of those that you're proud of? And how have you supported them on access to finance?
Okay, there's a third one. And then the fourth and the, awesome. Lunch is coming. You've passed one here. Okay, where's the mic?
Okay, thank you so much, the panelists. I have a question to Madam Judith. How user-friendly is the app, especially considering that you might be targeting a group that doesn't even have smartphones? And I'm asking this with regards to a community that I work in, yeah? People just have the kabambes. And then would you also give us some metrics of how many people, how many numbers you've reached, especially in Nairobi? And have you been able to disaggregate this data in terms of this particular community is from this area? Like, do you have that data that shows the uptake, both in the informal settlements especially, and like the general community within Nairobi? Thank you.
Hi, my name is Dr. Jennifer Wabugu, an associate professor in nutrition and dietetics. And I'm also a believer of natural healing through nutrition. I'm really interested in that bill because it would be important for us to also give it a touch in terms of technical inputs, so that we make sure that everything is there, because apparently even if we come up with supplements, it becomes very difficult for them to be registered through the Pharmacy and Poisons Board and such kind of other activities. I look forward to having a more elaborate discussion with you. Thank you.
Thank you. There's one more hand up front here and then we finish the 5. Oh, there are many now? Okay.
Okay, thank you very much. My name is Armak Miser. My question is going directly to Judith, Ambulex. I heard you mention about payment through the app. Does the payment cover the individuals or the family? Thank you.
We had a standing agreement of 5 hands, or we don't do lunch. Now we are going to 10 hands.
Thank you.
Okay.
So my name is Sylvia. My question goes to Dr. Billy. With this molecule, is it acknowledged, therefore being insured? And is this an acknowledgement that the normal medicines we are using are not safe? Or why are we going to whatever it is you're offering us? Thank you.
Dr. Billy.
Hi everyone, I am Kamuzinzi Deo, advocacy lead for a refugee-led organization. So my question is, to the whole team, I haven't heard you speak about really on insurance. It was also in the topic. So coming from a refugee perspective, do you have programs that target refugees? Because we have challenges in the health sector, being refugees not being able to get into the different insurance programs like the SHA, So thank you.
Okay, bring it up here. She was number 3 and then we close, yeah? The second one. So we replace the word insurance with assurance, right? Assurance for all.
Thank you for the
Thank you.
panelists. My question is for the ambulance. So I just want to understand how you make profit. Since you are a social enterprise, I can understand the impact, but how you make money out of it? Is it based on subscription or what? And also you said you are connecting with drivers. So the drivers, what they will get out of it? Thank you.
Okay, so allow us to respond to those ones, right? Since we have 5 minutes, so 1 minute each. We'll start with Madam Winnie.
Thank you. To respond to how many companies we've been able to support from, when they start to when they scale up, I'll say examples with Care 360 and Ambulex are actually part of our portfolio. And we've seen them articulate a lot of things that they've been done. You've seen what they presented, they've grown in a couple of years in terms of the impact they've been able to indicate. But overall, within our portfolio, given that we are marking our 10-year anniversary as Vilgro Africa, we've been able to support over 150 startups in healthcare across 33 countries here in Africa. Hope that answers your questions. Yeah.
Thank you. Was it only one directed to Vilgro? Okay, so I believe we are seated in the order of questions. Okay.
Thank you so much. Thank you so much for your questions. I'll start with you. So we make money through subscriptions, basically insurance, where families or individuals pay, and I think I'll answer that question as well, 200 shillings. For now, we've reduced it to that. Our aim is to get to 1 million families in the next 1 year, and that's how we're going to make money. The cover covers you and your family. Usually we charge 1,200 per year, but because we are looking to scale, we have drastically reduced that to 200 for now, for the next 1 year. The other question was on how friendly the app is. The app is very light, can be accessed using very basic phones. And for those who do not have smartphones, we do have a USSD that they can also use for that. And so for those who do not have smartphones, they can always give us a call, 0702, our hotline, 89 89 89. So we have that solution as well. In terms of segregation of data, because we offer gender-based violence response, in fact, in the country, we are the only solution that offers response and not necessarily just prevention. And how we do this is we work with the Kenya National Police to respond to GBV, and that 200 also covers for that. So if you're in a GBV situation, remember I said we started Ambulex out of a GBV situation. So we work with the Kenya National Police to respond to gender-based violence situations. And the app is also has that function as well. So you find that most of our customers are actually women because of that GBV component, but also women are more concerned with their health, and not just their health, but the health of their families as well and their household. So you find that more women are more acceptable in terms of taking up insurance or health insurance. And so we have more than, I'd say 67% of our customers who are subscribing being women, because they are more concerned about their children and their household. In terms of, we have served more than 22,000 families in the last 4 years that we have been operational. And a majority of these are coming from in Nairobi, Kawangware, Kangemi, Kibra, and Korogocho. We have, of course, others also within those areas. But we've also seen a lot of interests and subscriptions coming from Western Kenya, especially Vihiga and Butere and Kakamega, as well as from Bondo as well. So we've not seen a lot of interest from Northeastern, but we're working towards that as well. Thank you.
Thank you very much. As we move to Dr. Billy. She has mentioned that you get your insurance from subscriptions. So she did not mention the word insurance, however, but when you procure their services, you don't use it immediately, you will use it in future.
Yes.
That's insurance. Yes. Thank you. Dr. Billy.
Thank you. The first question was about the safety. At Idwell, we have partnered with the compounding pharmacy here. It's called Novici. And compounding pharmacy is just like, is a pharmacy that produces drugs in mostly natural forms. Non-synthetic molecules, but they're natural formulation. And majority of the drugs, or rather all the drugs that we use, they are all sourced at the compounding pharmacies. The other question was about what we are bringing and whether the other drugs are safe. Yes, what we are bringing is the natural aspect of drugs, or rather of disease management. We're not competing, but we're just giving an alternative to the pharmaceuticals. Then the other question was about the bill. I'm the founder chairman for an organization called IMSK, Integrative Medicine Society of Kenya, where we are mandated by the government at least to bringing standards and regulation within the Integrative Medicine Society, Integrative Medicine platform in Kenya, and you can join us. You can join us, and then for the petition, we'll be able to be to include you in that. Thank you.
Also to add on the same, we have the Kenya Bureau of Standards, and actually I chair one committee of the health informatics, and there's another committee on traditional medicine. We've just finished a standard on traditional medicine, but at least the first word is Chinese, right? So you can come as your organization to the thematic area of traditional medicine, right? Under Kenya Bureau of Standards, and there'll be no problem passing the policy, right? Because the people are the policy makers. Bwana asifiwe hapo. Amen. Now, with that, I think we come to the end of our session. We had promised 35 minutes. Is there a burning question? No? Very burning. You can't wait until afternoon. Okay, don't burn. To Judith?
Judith, concerning the ambulance. And I've seen from the photo, you'd clearly see you are engaging the riders for ease of access. These riders, they are the same riders you have mentioned, border. And sorry to say, you board these borders, you are well, but upon reaching your destination, you are unwell. The reason being, the question they pose to you, imekuonyesha ngapi? Twende offline, and the rest. Are these the same people you are partnering with, or are they undergoing a certain training? Yeah, because they are going to deal, or they are dealing with people who need the medical attention. Thank you.
Okay. Is there a shortcut to using your Uber Baridi?
Like that. Thank you so much for that question. Very good question. Maybe just to clarify is that the border riders we are working with, of course, they've gone through training, and they are specifically only transporting the emergency medical technician or paramedic to the scene. They are not transporting patients, because you cannot transport a patient on a border. So what happens is when the paramedic or EMT gets to you, they will assess your situation, and you find that in most cases, when they assess the situation and find that there's no need for an ambulance, they will discharge at scene. But if there's need for an ambulance, then they will call the closest ambulance to take you to a facility. And this is because, one, it reduces on costs of response for both you as a patient and also for us as a business. And it also reduces the time in which we take to get to you. Because I usually tell people the most important time is when that ambulance is coming for you. Because at that point, we do not know how bad your situation is. So we need to get to you as fast as within 5 to 15 minutes. And once this paramedic has been able to assess your situation and already knows what is the next course of action, then we can relax and an ambulance can be sent or you can be discharged at scene. So we do not use the border borders to transport patients. Thank you.
As we close, this is my third ACOSE to attend. I came as a youth leader, but on my third year, I'm now running Queensway Medical Training College as a social enterprise. One asifiwe. So the fourth one, I'll come here as an investor. Okay, so let's give a round of applause to our presenters, Dr. Billy, Judith, and Winnie.